If we're gonna look at pills, there's actually two types of pills that we use for sleeping. Hello everyone, and thank you for your time. This is SAC Health Answers, our video series where we answer questions about your health. I'm Dr. Jason Lohr, CEO at SAC Health and also a family doctor in our community. And our first question comes from Miguel. And Miguel asks, I'm in my mid-40s, I work an office job, and lately I just haven't been able to fall asleep. I'm considering using sleep aids, but I'm not sure if that's the right move. What should I know before I reach for a bottle, and what is specifically recommended as a sleep aid? This is a common concern, especially for folks in their 40s, and especially when we're trying to balance high-stress careers and physiologic changes that come with age. You know, in your 40s, your body produces less melatonin, and melatonin is the chemical that is released to help us relax and to fall asleep at night. Especially when we're doing a desk job and we're not getting a lot of exercise during the day, it's really hard to get home, relax, and be able to fall asleep without the brain racing and thinking about so many things that happened during the day. But before reaching for a sleep aid, we always want to look at the why. What could be underlying the cause of the difficulty with sleeping? Are you getting enough sunlight during the day? Are you using blue light like a cell phone or a computer right before hitting your bed to fall asleep? These environmental factors often have a bigger impact than a pill. If we're gonna look at pills, there's actually two types of pills that we use for sleeping. One are the over-the-counter pills. These are fairly effective. They're usually antihistamines. They'll make you sleepy. The problem is they can help you fall asleep, but when you wake up in the morning, sometimes you're groggy and still drowsy because the medication is still having its effect. So that can be a challenge when you have to work a full day. The second type of medicine that's available is melatonin. And melatonin, again, is a natural chemical that the body produces to help fall asleep. The problem with melatonin is sometimes the dose could be more than you actually need, and it can impact the body's ability to actually make melatonin, which is a natural thing that is produced to help you fall asleep. Ultimately, regardless of a medication that could be used, we don't want anyone to develop dependency on that medication. We want them to be able to still fall asleep naturally. That's why we look at the whole picture when we're taking care of patients who are dealing with insomnia. If you're struggling with chronic insomnia, we definitely have doctors available and even behavioral health providers available to be able to figure out exactly what's causing it and exactly how to treat that underlying cause. We can work on stress management. We can work on other areas that really can help you to be able to sleep soundly and effectively. So thanks for this practical question. If you're tired of being tired, schedule an appointment with your primary care doctor who is your partner in your health. Until next time, stay healthy and sleep well.